we haven't made any changes to the bill.
Right.
I brought up a number of discussion points yesterday with respect to numbers of procedures that are included in the bill, and there wasn't, I don't think anyone else on the committee was interested in making changes. That's not, except for one. What changes would you like to make, Senator?
No, I think it's just comfort level, and I think I feel more comfortable with the base.
Starting with a basic,
But yeah,
a
step, you let the steps approach.
there was one that that we had in testimony. We heard the direct the first correction for glaucoma. That one. Same. I mean, so we're at the end of the day, end of crossover day. So if there are suggestions for change, I need to have them right now. For Jen's sanity. Okay. Senator Gulick, do you have any suggestions for change in S64?
Not at this time. Nope. Thank you.
Okay. Okay. It won't be me and it won't be Senator Cummings more likely that to put forward a motion, but I think it's probably time for a motion if that is what the committee desires.
I'll put forward a motion that we move forward with S64.
So you can say
Only the right words.
the right words. Okay.
Okay, so I have a motion.
Motion is to pass S64 or favorably.
S64 and introduced.
As okay. Senator Benson,
Yes.
Senator Cummings,
No.
Senator Gulick,
Yes.
Senator Morley, yes. Senator Lyons,
No.
3-2-0.
Who wants to report it? We expect a full description of each.
I get it. Best that I can.
I'm not anything. And so, and I don't excuse myself from speaking on the floor. I ordinarily, we don't do that. Many, but as chair, I will speak to the bill.
Wonderful.
We're gonna watch and see if you can pronounce each of the persons. Oh, I'll try.
So you can't pause to ask for to cancel the pronounce them.
You're kidding.
That's assuming they can proceed back. I'm not trying to do the
Okay?
We know Senator Lyons cannot run the ambulance. Give you a phonetic.
Yeah.
That is true.
Well, I certainly hope that should the bill go forward, and that it will accomplish the goals that we've heard it will accomplish, and that is to provide coverage in rural parts of the state and to ensure that we have adequate care for people, who need that. Need it. Okay. I knew you should have raised the bar.
Right, yes.
So let's move on to, Jen, which one is the easiest for you?
So I don't think I've introduced myself on the record today, Jen Kirk, in the Office of Legislative Counsel. I think the one with the fewest changes is S-197.
Well, then let's look at that.
Literally
That's what that's what I thought.
Came from yesterday.
Yeah, okay.
Did I send you that one? I don't see it posted. 497. Yes, I have it. Okay, it's not posted. Sure, but I can pull it up from my, from my, Word. That one. So it's just minor change from yesterday.
I know.
All right, so S-197 is an act relating to establishing a primary care payment reform program, at least as introduced. And that name is proposed for change later in the bill. We walked through this yesterday. At that time, there was some language that the Medical Society had proposed in the piece of it that had not, I think, the AHS folks had taken it back to consider, but hadn't responded. So I've incorporated it into this draft and it's there. I'm
Good.
happy with it. They can pick it up now.
We're happy with it.
Great. So the one change in this version, I believe, is simply in section, there's now section 7, the report, AHS report on transitioning care to community settings. And there were specific entities named to be consulted with in preparing that report. There was a request that the chair pass along to me from Bi-State Primary Care Association to be specifically named in that list. And so
Yeah, I think they're pretty key that they are a primary care provider in the state. Makes a little sense.
That is it. That's the only change.
Okay, then, committee questions for Jen on or anyone else on the draft that we have on this? Good. So it really is a primary care based on our Blueprint program, which has received a lot of attention outside of our state and continues to do that. And we've heard from our insurers and others, their support for the work that we're doing. So I'm very excited about this bill going forward and hopefully we can support it. So I'd accept a motion unless there are other questions.
Okay, I'll move approval of S-197 draft number 3.1 dated 3/12/26.
Okay. Will this bill go someplace else? No, does this bill go somewhere else?
Oh, no, that's up to the clerk.
Okay,
I
No,
don't,
it's not. the secretary.
sorry, secretary.
So, okay.
I'll let him.
Yeah, it's a secret only on YouTube. Okay.
And the bill as introduced,
I was
bill
thinking,
as introduced may have,
I think it might have had,
it might have had,
yeah,
I haven't been over, I haven't looked over the latest version.
yeah, it's okay.
latest version doesn't, but I think the bill is introduced May because it was establishing primary care
Fun.
payment reform program.
Yeah.
But I will have to see if Secretary thinks.
Okay, so the motion is to vote favorably on draft 3.1 of S.
197.
7. And it's a strike all, so I think as. and
Strike all
recommended,
version.
It goes all to the, and recommended to the full set.
Discussion. Good? We are good. Thank you. Okay. So clerks,
All right, Senator Benson,
Yes.
Senator Cummings.
Yes.
Senator Gulick,
Yes.
Senator Morley, yes. Senator Lyons.
Yes.
5-0-0. Your baby.
So I'll report it. And so, no, I don't know, secretary will probably send it somewhere because they had the word fund in it.
That's really good.
Yeah.
FUN, fun.
If you went,
For the record, no, 911 joint fiscal office. There are no appropriations. We're not creating any special funds, and there's no fees. The only thing you have in there is change the blueprint payments. So I wouldn't be surprised if it is sent to appropriation, but I've talked with AHS and there's no appropriation needed. So I'm gonna look over the bills, and but I don't.
Somebody fell down the stairs.
somebody fall?
Yeah.
Uh-oh, this is how.
It's not that bad.
It was just-
Anyway, so sorry.
I hope they're okay.
Yeah.
So I'm looking over this weekend and determine whether a fiscal note will even be needed. Or if it goes to approach, maybe I'll have to do fiscal note to say no appropriation to, but I have to look over the bill.
No problem. Well, understand exactly where we all are right now. Yes, thank you.
My expectation is there is no actual fiscal note, but that the use of the word payments and funds may have it sent to
Trigger something.
appropriation. Okay.
Thank you. That's a good bill. And I look forward to it going forward. All right, let's move on to 190.
Okay.
Is that also draft 3.1?
Fell down the stairs, blood drops.
Somebody's hurt.
Yeah.
Yeah, but she's not getting care, so
She's not what?
the police are there, but she has not requested.
Oh,
S190 is an act relating to the Green Mountain Fair Board reference-based pricing, and the name changes again at the end to reflect the study. So I'm trying to preview for myself where I made changes, so I don't make
There was a section that appeared to be redundant or not needed. Yes, one.
So I think there was, are you talking about what I was just informed about?
Yes, that one.
Right, so when we get there, I can flag it.
Okay.
I don't think it's redundant, but I think if there's a suggestion that it come out. And
Okay, we can decide whether to take it out now at the end of the day or whether we can let that.
Right, I mean, from a drafting standpoint, very easy, so if you want to take it out.
Oh, okay.
Just 3.1.
This is 3.1. So
Thank you.
we're in reference-based pricing is where we start. And if you remember a conversation yesterday, there was discussion between the Green Mountain Care Board and the hospitals about how the hospitals present information around their current prices and the benchmarking to Medicare rates. So based on the result of that conversation, I've done a couple of things. First, I've just moved. So if you remember, that issue came up in the context of both the provider contracts, where the hospitals and health insurers are supposed to start expressing rates as a percentage of Medicare. And then also down here, when making public the charges for items and services as required by federal law, the hospital would provide that information as a percentage of Medicare rate. So I've taken it out of its standalone subdivision E here, but just moved it up here and made this one C1 and 2. So that I have no substantive change to the part about making public the charges showing as a percentage of Medicare. I'm just moving it because I've made these two provisions, subdivision C1 and 2, and added a 3 that says for subdivision purposes of subdivisions 1 and 2. That's why it made sense to put them together. A hospital may express rates as a percentage of Medicare based on the actual reimbursement amounts the hospital receives from Medicare for items provided and services delivered to Medicare beneficiaries until such time as the Green Mountain Care Board adopts a rule establishing the methodology for determining Medicare rates for use as a benchmark in establishing reference-based prices under this larger reference-based pricing subsection. So basically, hospitals can use the info they know based on what money actually come into them from Medicare until the board has kind of established the across the board Medicare benchmarking that the hospitals then would be able to use. And unlike some provisions where I talked about the applicability, so certain caps that we put in would be in place until the Green Mountain Care Board is actually applying their new rule. This one I based on adoption of the rule because that it's a methodology. So once the whole rulemaking process has been completed and the rule is actually adopted, that seems like it should be sufficient notice to the hospitals so they're ready to use the new methodology.
I also assume hospitals have some voice in the discussion about the rules.
Right, there's the public process, right, for rulemaking. Exactly. So hopefully this works for people, at least for now, we can keep.
Now, I agree that now, then it comes back completely different.
Okay.
Can I ask, could you define machine readable files?
I cannot, that was like.
Well, I did, somebody's gonna ask that question at some point. Looking at Devin, can we,
Sure, Devin Green from Buzz. It's basically like it can just be an Excel spreadsheet, right?
Oh.
Like, and you put it into a computer file sort of scenario.
and I
And
can
I
pull
think
it
it's
up on my-
probably searchable. Yeah.
And I can print it out. Okay.
I would have to go in, but I am assuming that language is used in this federal
Yes,
regulation.
that
And
is
so
correct.
that's why it's just using that as kind of a tie in.
Okay. Good.
All right, and then, so as I said, I just moved the language in subdivision in capital E here up to become part of subdivision C. Just a language change here for clarity. In the section 2 language on the reimbursement cap for the $250, 250% of the Medicare adjusted base rate for qualified health benefit plans, it was pointed out to me that it could be confusing to say an individual enrolled in a qualified health benefit plan because that could suggest it was only the individual market. I think arguably it's hard to have us, you don't deliver services to small businesses enrolled in a plan. But I think it's clear, it may be clearer to say enrollee, and that is a term that gets used in the chapter. So just change individual enrolled to enrollee.
Raise Devin Green from Buzz on one thing in here is the Medicare definition.
Oh,
We would like to see match the above Medicare definition.
Is
That
it not?
not for section 2.
Oh, you want to see it as far as the actual amounts piece or?
No, because
Same.
section 2 has the old Medicare definition as part of the 250%.
Okay.
You go, I know, I went, okay, stop it.
Yeah.
Right there, A1.
Medicare adjusted base rate.
Right, that's the old definition.
Yes, but I wasn't aware that there was talk about changing to change it to the amounts hospitals actually received from Medicare. So I wasn't aware that was part of the conversation yesterday. I thought it was specific to the information that had to be provided included in the provider contracts and the public lists. I'm happy to change it if that's the direction the committee wants to go, but I wasn't aware that was.
I didn't remember our talking about changing that. But does this leave us with two different definitions?
No, because there's no definition. the language here doesn't use the Medicare Adjusted Base Rate term or define it. So it just says, show them as Medicare and
So if they show them as, they
talked about
loaded
data.
rates for different hospitals, but they didn't talk about.
Well,
What is what is the concern that you have?
the concern is operationalizing it again. Like our critical access hospitals can't convert to the PPS to get to this in this time frame. Like we will be unable to do that. It's the same issue as the reported piece.
Okay,
Emily Brown, Green Mountain Forward. I also, because this is an insurer based on the insurer's plan, right? I think it would be interesting to hear if on the insurer side, if they would be able to do it based on this definition. I hear Devin's concern, but because this is a plan-based change and not asking the hospitals to make the calculation, again, I understand there'll have to be a way to check it with the hospitals, but I'm also wondering if, because this is the QHP plans and not asking the hospitals to do it, if there is a way the insurers can do it that doesn't put the burden on the hospitals.
what's the answer?
Courtney Harness, Blue Cross and Blue Shield, yes.
Yeah, so the insurers will have some responsibility for helping out.
Yeah.
Okay, so we don't have to go into this.
Okay.
We will have a higher court.
Okay, section 3. Not changes since yesterday. Here's a new section based on interest in understanding the impact on the VHI and state employee plans. This would direct the Green Mountain Care Board in consultation with Departments of Financial Regulation and Human Resources and VHI to analyze commercial health insurance claims for inpatient and outpatient hospital items provided and services delivered to active and retired members and their dependents enrolled in the state employees health benefit plan and in the health plans offered to teachers and other school employees through VHI to determine the opportunities available through the use of reference-based pricing and the projected impact on Vermont's hospitals. It requires VHI, Department of Human Resources, and the administrator of the state employees health benefit plan to provide the board with access to the claims data necessary to perform the analysis. And by January 15, 2027, the board would provide to this committee and House Healthcare, the board's findings and any recommendations with respect to scope, timing, financial impacts, and other considerations in implementing reference-based pricing for items provided and services delivered to enrollees in the state employees plan and the health benefit plans offered by VHI. That sound like what people had in mind?
Yeah. So on the other. Oh, got it. Okay, it's all there. So, good, great, yep.
And then the only other change I have from the draft we looked at yesterday, other than changing section numbers again, is reducing the appropriation for the study committee. Here somewhere. I think after further discussions with the chair, from 200,000 to $50,000.
And joint fiscal variance.
Because of the short-term nature of org.
Yeah,
And that is it. Oh, but I did forget to mention the piece that was
right.
supposed to come out.
That one,
So that, as I understand it, we're back in section 2, the cap on reimbursements for that 250% of Medicare for qualified health plans. And my understanding that the board and the hospitals would like to remove the language in subsection E that says the purpose of the section is to reduce costs in a hospital shall not increase the amounts charged to other commercial plans or private payers in an effort to reduce, to offset reduced revenue, unless the board authorizes the increase.
And the reason that, you're suggesting removing this?
Is, yep, Emily Brown, Green Mountain Care Board. The reason we're suggesting removing this is because we have budget guidance that effectively already does this. So currently our budget guidance is a -1% for commercial rate. And how we've historically done it is as long as the carriers are within that -1, or I'm sorry, the hospitals are within that -1%. Then they're satisfying our budget guidance. We thought this was duplicative because it added an extra requirement on top of what our hospital budget guidance is already asking the hospitals to do. And so underneath that -1%, in addition to the 250% of the reference-based price for QHP, the hospitals are going to need to have to meet that -1%. And so we felt like this was putting too much of a burden on hospitals to be able to meet that -1 and could effectively put them far below what our budget guidance would have been requiring hospitals to target.
So your budget guidance changes over time. This really describes the purpose of the section. So within the context of this bill, what we're trying to do overall is to reduce healthcare costs.
Correct.
So it's not so much that we're not directing anybody to do anything here. We're just saying that the purpose of what we're doing is to make sure that healthcare costs are held at a lower. And so I don't know why we take it out. When I hear what you're saying, because it's budget guidance, it's just an overarching kind of purpose.
So if I can clarify a little bit, I
me
think
with that?
maybe, and then the parties, I think Madam Chair is correct as far as the first sentence, the purpose of the section is to reduce healthcare costs. I think it's the rest of it that is creating concern, because it is kind of tying the hands of the hospital with a part of how they would be
Understood.
setting their budgets. And so the board is saying, if they are moving things around within the parameters and the guidance.
Perfect.
Yeah, that's correct.
Understood.
Yeah. Correct.
So take it all out.
So I think, I don't think there's a reason to leave the first sentence sort of.
No,
So-
take it all out. That's fine. I mean, as long as everybody else at the table agrees with me.
Not too much, it's just a subsection. And there's only one answer. Now I'm having, and I need to make a clean copy. All right, so I'm just gonna take, if it's okay with the committee, I'm just gonna take it out and not show you a new version that has that with lines through it.
No, that's fine.
I'll just make that new.
It'll still be a strike goal. It will be something else besides 3.1.
Exactly, I'm just making 3.2. It's not that big. Do you want to do something else?
3.2, that's what you said.
Yeah.
Is there anything else in here that's? I understand the initial comment about the Medicare definition. Hospitals come to me, the insurance company, and said they're helping with that, so.
We should, Madam Chair, Porting Harness Blue Cross and Blue Shield of Vermont, there's a chance with the timeline that Boz recommended, the insurers could support this timeline, but it may cost money that could lead to increased premium. So I would just bring that to the committee.
So this is a good time to bring it to the committee, since we're gonna vote, but what we'll do is, as the bill moves forward, that will be a conversation. Understood. I know, things always pop up at the last minute. I'm not complaining about that. I understand how that works for everybody. Some things comes for us. Cost time, money. Yeah.
It's paperwork.
which isn't on paper anymore, is we have to buy readers. All right, so Jen, we've struck that section,
Struck that subsection, yeah.
subsection B, subsection 2. And now we have a bill. We have a strike off bill. All right. Discussion on this bill. Other things. Okay, so I would entertain a motion on S-190 draft 3.2. Send to the full Senate? Send it to the full Senate. Well, if it gets there, it's gonna have to go to appropriations.
Yeah, yeah.
It's gotta go to appropriations. Okay. It's got $50,000.
You're gonna have a busy week. You're gonna have a busy week this week.
Oh, approach, which, yeah, yeah. Discussion? We've got a motion on the table. Okay. Mr. Clerk, Senator Clerk.
Senator Benson,
Yes.
Senator Cummings.
Yes.
Senator Gulick,
Yes.
Senator Morley, yes. Hopefully a change later on. Senator Lyons,
Yes. Now I'll take this one also.
5-0-0.
Budget.
I've been. All right, so that's great. Thank you for that. So Jen, let's, we've got two other bills we want to look at. One is 142 and the other 154.
Yes.
Do that.
Just, okay, give me just a second, I'm sending. You guys are doing a bit of real time, I'm sending the ones you have finished to Calista so she can post the final versions.
Which one you on now?
142. Is that the one? Is that good? with you?
That's either one is fine.
Okay. This one is the internationally trained physician.
Yeah.
And the Department of Health has asked for some time to evaluate what goes on in other states and what they might do. So through the Board of Medical Practice, how they might facilitate this. So if we have any language, I did send some language in from them, their suggestions. So I thought we had talked about this bill. We can just look at what they say and decide yes or no.
Yes, so here's what I have done based on your conversation. S-142, an act relating to a pathway for licensure for internationally trained physicians and medical graduates. So it keeps the whole pathway process set up in the bill as introduced. So it's not a strike all. It just strikes out the effective date section, puts in a new section and then some different effective dates. So section 4, I called it alternative pathway to licensure for internationally trained physicians and medical graduates with a report. This would require that by January 15th of next year, the Department of Health, in collaboration with the Board of Medical Practice, would provide to this committee and the government operations committees and your House counterparts a report detailing a pathway to licensure for internationally trained physicians and medical graduates as an alternative to the pathway established in Section 2 of this Act. The report would include the following information: a summary of other states' processes for licensing internationally trained physicians and medical graduates to practice medicine, and available data on the outcomes of the processes and related programs. A description of the external resources needed to evaluate the education, experience, and examinations of internationally trained physicians and medical graduates, and the availability of these resources. A proposal for licensing internationally trained physicians and medical graduates to practice medicine in Vermont, including potential qualifications and supervision requirements for licensure, a summary of any additional resources and statutory authority needed, and a plan and timeline for implementing the licensing program, and any additional information the department deems relevant to a robust consideration of the issues related to licensing internationally trained physicians and medical graduates to practice in Vermont. In preparing the report, the department would be required to consult with other states that have implemented licensing programs for internationally trained physicians and medical graduates, the Vermont chapter of the NAACP, third-party credentialing services, the Vermont Medical Society, Vermont Association of Hospitals and Health Systems, and other advocacy organizations, researchers, and other entities whose expertise is relevant to developing the report. Section 5, the new effective dates would move out the effective date for the pathway to licensure established in S-142 as introduced to 2028. It would have the rulemaking take effect, so the authorization for rulemaking take effect July 1st, 2027. And then with that report coming back to you in January of 2027. So you can decide if you want to change what would otherwise be set in motion beginning in July 2027 with the rulemaking and go and begin on July 1st, 2028. Or if you want to do no changes and allow that to go into effect. And section
I think
4,
that puts
alternative
pressure on
pathway,
both sides of the fence
right,
here.
would take effect on. That's, again, it doesn't undo what is in the bill. And it doesn't make any changes to what is in the bill other than delaying the effective date and the needs report from the Department of Health and Alternatives.
And we were gonna change the date anyway.
Yes.
Yeah, so. Good comment.
Yeah. I can't remember talking to the Department of Health on this.
You talked to the Board of Medical Practice.
Right.
Board of Medical
With it-
Practice, that's
just within,
the-
right,
It is,
Which-
okay.
yeah, just.
And so there, the suggestion that came from the Department of Health was rather than put the Board of Medical Practice in this, put Department of Health, and they have been working on this since their second go round with testimony.
Right, and I think to
So
be clear, I
it's on
think,
board.
to be clear, I think the Department of Health, and they can speak for themselves, but would prefer you just did the report and you didn't do the rest.
Right.
You didn't set something in motion to begin. Unless you want to do it. So this is the committee, so I don't want to be represented, right, this is giving the board that department the report, the study and the report they asked to do, but it is also setting something else in motion unless you come back as the legislature when you hear the report and
Change.
make changes.
Let's think about that. Told us their feature is fine.
Right, so the initial testimony we've heard from the Board of Medical Practice was, don't do anything, we're not participating. Then we heard, don't do anything, we'll think about it. And then we have a recommendation from the department, which I think is very beneficial to this, and looking at what other states are doing, because you would ask that question as well.
Yeah.
What's going on in other states, and look at Tennessee, and we've heard from other.
Well, we've
other
got
ways
a
of doing
lot
it.
of this, it's an international recognized surgeon.
I know, we do have that, and that, we're trying to find a path
Yeah,
for that.
no, it's
Yeah.
like, we're talking about New York State, yeah.
Yeah, New York had the both.
It doesn't make any changes to the bill as introduced, so there may be things in that house that people want to tweak
I think they
on
will.
that. As far
Yeah,
as
I think, it could be that,
timing or, alternatives to the timing for people who have been in Vermont sort of waiting for this.
yes. And then, and the other piece of it is that having the bill go through as it is unless the legislature acts. It might be that the legislature must act again in order for it to continue. So there are a lot of options in there. I think we're at the end of February, end of March 13th. Friday. the 13th. Okay. All right. The more discussion, because this is.
My
and-
only observation is that we have a lot of really important reports coming to us January of 2027. And we're going to have to, act on all of those because a lot of the really important work that we've done won't go forward unless we, take those reports and act. So hopefully we'll all be back in January. I don't know.
We'll find out. All right. Jessica, did you want to add a comment?
Sure, Jessica Shapano, Department of Health, and thank you again for your consideration of the Department of Health's work suggestion. And, you know, in looking into this, a lot of states have passed this legislation, but they're still in the very early stages of implementing it. And the department and the board do have some significant concerns about the amount of resources and the expertise it's going to take to implement this. So we want to really understand and leverage everything that is happening elsewhere. And there's also a bunch of third-party expert organizations that are working to help facilitate these processes like across the US. So we want to just make sure that when we do this, we leverage everything that we can, we do it right, with the most efficient pathway that we can for both the department and folks seeking licensure in the states. So just ask for that additional time to be able to figure that out. So
It seems reasonable, thank you. And so I know that it's been difficult. I know there's a lot of work that's been going on with the cohort folks in the southern part of the state on this and trying to reach out to Board of Medical Practice, but it's different from actually coming in here and putting together some recommendations. So appreciate the time the department has taken on this.
If we don't do it correctly, something bad will happen that
Agreed.
will stop probably programs nationally. Yeah, we're talking about people's lives on both sides.
On both sides. Okay,
What version are we at?
1.1, I think.
Yes, but this is not a strike all amendment, so it would be.
this is an amendment
Right,
to the
to
bill.
amend the bill. As proposed, and draft 1.1.
S 142.
Right.
Okay. Any other discussion?
Will this go to appropriations?
I don't think it will.
I don't think so. There are no, I don't think it'll go to either money committee. There's no money in it. There have been suggestion to consider fees, from the medical society, but that is not in here, so.
Guys, maybe the bill or the underline.
Okay, well, let's, I'd accept a motion on the amendment.
I'll make a motion to move the amended S 142, which is draft 3.1. Wait,
No. So we're just moving an amendment to draft, this is draft 1.1 of an amendment to S 142. So we'll do that first. And
Okay.
then the bill is.
I move to, you guys do it. Go ahead.
No, you go ahead. You're doing great.
I move to amend the bill, S 142.
All right. So 1.2 or 1.1?
I think it's at 142.
Oh, 142.
Yeah.
Okay, good. All right.
So yes,
Perfect.
draft 1.1, yeah.
All right. Discussion on the amendment. Okay. Mr. Clerk?
Okay, so this is for the amendment. So Senator Benson,
Yes.
I think I'm gonna do this, I'm gonna do the amendment plus the underlying bill. We'll just divide the sections here.
Yes, you can do that.
Okay. Senator Cummings.
Yes.
Senator Goulart.
Yes.
What's the answer?
Yes.
Senator Morley, yes. Senator Lyons.
Yes. Okay, now we need a motion to move the bill favorably as amended to the full Senate.
I make a motion to move S 142 draft 1.1 amended version to the full Senate.
Okay.
Any other discussion? I know the House will be working on this. This isn't the end of it, but I think it's a start. Okay.
Okay, Senator Benson.
Yes.
Senator Cummings.
Yes.
Senator Hewlett,
Yes.
Senator Morley, yes. Senator Lyons?
Yes.
5-0-0.
All right, so I'm looking at the screen, Senator Gulick, is this someone that you would like to report?
Sure, I'd be happy to. I'll be reporting a lot next week, I think, because
Well,
I
it's up to you, because I think we could find someone else around the table who can report it.
if someone else has a burning desire, I will acquiesce. Otherwise, I'm happy to do it.
Want to do it?
I can do it.
All right, Senator Benson has volunteered.
Thank you.
My arm's twisted.
No, that's good. I've understood. Everybody's very busy, so it's important to spread the wealth. All right, we are down to 154.
All right.
Ten minutes ahead of us.
154.
Excellent.
154.
154.
154 is the biomarker bill. Now, yes,
You want to
go.
Why don't you discuss first?
So I'll try to do this first. One of the concerns about the bill is that if we don't have a fee in it or some other financial something, it will, we can't get it to finance where it really needs to be, really needed to get to finance. Then with further conversation with joint fiscal and ledge council, it was clear that if we had some kind of assessment, evaluation. God, what's the name of the study I'm thinking of? What's the study? What kind of analysis? What's the analysis? DFR analysis.
Oh, actuarial?
Oh, thank you.
Oh, my gosh, I forget that one.
Oh, that one. Why do I forget it? All right, so
You guys
a,
do the insurance.
right, an actuarial analysis that actually, in talking with the secretary, it might go to appropriations with that, but it would give time for assessment by finance, should you so desire to have a look at it.
So I did put a fee in it.
Oh, you did?
Yes.
Oh, bless your heart.
But I think it's a fee for the purposes of getting
Getting
the
into
bill
finance.
Yes. So I'm concerned that there will be alarm about the fee.
Yes. The issue we're trying to work through is this committee looks at whether or not it's a good thing. to-
Good idea.
Medically,
Yeah.
yeah. Finance looks at the impact on health insurance rates. We have, over the years, added things to our exchange plans that were really good things. And individually, every one of them was a small cost. But you put enough grains of sand in, eventually you have a beach. And I think the thing that caught my attention is that our bronze plan or silver plan costs twice as much as it does in Maine. And Maine has a very similar demographic, so we can't say it's because we're all old. And if we add this and it is not part of the federally mandated services that we cover, then the state of Vermont has to cover the full cost. And we've heard that individually, each one of these tests costs anywhere from, we've heard, $250 to $46. But we haven't really had. Or
I've looked at the,
I thought it was.
we haven't looked at the
They started at
financial implications.
2,500.
Yeah.
Somebody yesterday said
That was
they were down.
500. Okay, but-
Yeah, but we haven't had time to analyze. How many tests do you get? How many, in what impact might that have? We've lost 2,000 people off the exchange so far this year in the enrollment period. It's good that everybody should have access, but if you can't afford the insurance, then you don't have any access. So we're trying to get it so it gets an analysis so that when, and it's probably when we do it, we know what we're buying into.
So you're looking for what, next year?
So we'll look at the language.
No, no,
Do you wanna
no.
look at the language?
What we're looking for is language that will carry the bill to finance so that they can look at the bill and
Okay.
answer some of the questions that finance
Okay.
had.
And finance will probably, given our time frame, ask for an actuarial.
Well, that's what's in here, so that's
So
why I want to
that's
look at
in here.
That's why I want to look at.
Then it will go to approach. So DFR can say what that will cost.
Okay, let's look at the bill and what's
in.
in here, and that, now, I think this is helpful. Chair of Finance has
Yeah.
given us the overview from that perspective. We know that we feel this is valuable for patients who need ongoing testing and care for cancer or Alzheimer's or whatever other biomarkers are out there. So, and
Right.
how do we cover them?
Right. So this is a strike all amendment. And it really just directs analysis and reporting. So I started out with the same definitions as in the bill as introduced, because I think they're important to sort of inform what then we're asking to be costed out. The only one I took out was health insurance plan, because we don't really need it for purposes of the analysis. So I directed the Department of Financial Regulation and Agency of Human Services to analyze the costs associated with requiring health insurance coverage and Medicaid coverage respectively for biomarker testing for the purpose of, now this is exactly what was in the bill language, purposes of diagnosis, treatment, appropriate management, and ongoing monitoring of a patient's disease or condition when the test is supported by medical and scientific evidence, including, and then again, all of the same provisions as in the bill as introduced. I have the report again coming in on January 15th, by January 15th. And DFR would report to this committee and the finance committee, because it's insurance and house health care, on the estimated amount that health insurance premiums would increase if Vermont were to enact legislation requiring health insurance coverage of biomarker testing as set forth in subsection B, including the amounts of the state's financial obligations for defrayal of premium increases for qualified health benefit plans under federal law and for premium increases in the state employees' health benefit plan. I also said by January 15th, 2027, the Agency of Human Services would report to this committee and House Health Care, not finance because it's Medicaid, regarding the approvals that would be needed from CMS in order for Vermont Medicaid to cover biomarker testing as set forth in subsection B, and the costs to the Medicaid program if Vermont were to enact legislation requiring that coverage. Then, solely for purposes of having a fee that gets it sent to the Finance Committee. So if you don't feel like it needs to go to the Finance Committee officially, we can take this out, but I believe my instructions were to put in a fee. This is what I came up with overnight. This would be a $5 per person per month fee from health insurers offering qualified health plans to the Department of Financial Regulation based on each enrollee in their plans.
I can see why it's a lightning rod.
Right, so that's why I wanted to be, I mean, anything you put in here. So if you think it needs to go,
So
if you think
the
it's going to go to
question-
appropriations and that time will give you what you need, then we can take this fee right back out.
I can't see us doing anything more than what's already in.
Okay, so having the actuarial analysis by DFR is sufficient, and if it goes to appropriations, that would be helpful.
It may go,
Yeah.
it's my understanding, what we've looked. Senator Brock and I tried to have this done for, doing away with, prior approvals.
Oh, right.
And I thought at that time, they do have an actuary on.
Yes, they do have a contract.
Yeah.
With, I think, more than one actuary.
Yeah, they do.
So, but what it would cost, I don't.
Yeah.
So it will go to appropriation.
So would you like me to take out then this
What do you?
And I'm sure the insurance
that
companies
monthly
would like to take it out.
Made up fee. Yes.
Like to take it out.
Made up fee. Yes.
per member per month?
Yeah, no, I'm gonna go with the chair of finance. I think,
They'll move it forward. It's gonna go to
I know.
the House.
but let's get it. let's
I
get
was-
the information.
Can I turn to,
For the record, the language of fiscal office, if you're want to make sure that it goes to appropriations, you can appropriate $1, right?
Don't do $1, but
You know,
yes.
so you can appropriate like, I don't know, $20,000 to DFR or something like that to ensure that it goes to appropriations. For the actual
probably
amount.
should do that, or,
Not $1, but yeah, but like some amount for the actual
well,
analysis.
yeah, although in talking with the secretary, he said, well, if you put an actuarial analysis in, for DFR, it'll automatically go to appropriations.
Right.
So I don't think you need to put any money right here at all. Yeah, but so,
So may I delete the
Well,
fee?
I guess the question was, are you trying to make sure it goes to appropriations or you know, care?
Sounds like it will. Sounds like
I
the
think it will
secretary is
go
now
regardless.
expecting it and it will.
Yeah.
Yes, if the secretary says it will.
yeah,
And it's just a step.
yeah.
Yes,
Right. So may I take out this fee?
yes.
Right?
Sorry, you thought about it all night long.
Okay, it just. I'm a little uncomfortable to have a. Okay. Great, then this will be,
Draft what?
we'll make it 2.1. And it will just be the study and. Whoops, I lost my effective date.
Good, it's really medically, it will be great if we can save healthcare dollars doing things.
It'll be today.
Okay.
Almost exactly 12 hours after. And that. Okay, so I'm on this. Word document up on the screen. All right, so this is now, I said 2.1, but
Yeah.
under that change. This is now 2.1. It is still the same study we just looked at, studies and reports. And now just the effective date.
Okay, so this is a vote to amend.
Yeah, it's a start.
Yeah.
Okay, so then I can just vote move to approve.
Right.
S-154, version 2.1.
I just got to know.
You made a motion to approve
Thank you.
2.1.
Senator.
That's the little email thing.
Everybody is contacting about,
Yeah, they probably want to know about that
Last minute.
fee that was in there.
Yeah.
thank you, Senator, for that motion. Discussion on the motion. Okay,
Okay,
Senator Clerk,
Senator Benson,
Yes.
Senator Cummings. Senator Gulen,
Yes.
Senator Morley, yes. Senator Lyons.
yes.
500.
Lovely. And Senator Cummings, this will be your bill.
Yeah.
Good, yeah.
That gets out.
Yes. And you know, as it goes through everything, can always, your committee can always take a look at it for us.
I think it goes this way.
Yeah,
It's moving in.
yeah.
But
It keeps it alive. This is
and
the
it's
moment
going
to
to the
the
House
house.
still.
Take over the pen, and I'll- Yeah.
We'll just get that. And we got told my committee what was happening yesterday, but I don't know what happened today.
That's, and you want me
Not
to
at first.
come in next week, just walk through, you know, so it's, it was. Or today, what-
Yes.
Just.
Okay,
We don't have to. Sorry.
all right. We could,
Was that 4 bills or
4,
um,
5?
5 bills?
but you know, that we've been working along pretty consistently. most. We do have another bill up there, it's 194. I'm gonna suggest that, S-194 is, I've been in contact, it's about the payment reform, conflict-free case management and payment reform that we worked on during the budget adjustment. And there's a lot going on outside with the agency, human services, and our designated agencies. I have some language for an analysis of how the DAs, what the DAs do and the rest. I'm thinking I might bring some language in here for us to look at and suggest to go into the big bill, into the budget, so that we don't have time to evaluate that right now. People that we hear yesterday.
Yes.
Amy Johnson, Vermont Care Partners, so I think if we hold that one off, we can look at it together, we can make a decision to send a recommendation to the Appropriations Committee for inclusion, or we may find another bill that it fits into that comes to us from the House, but we really don't have the luxury of time to look at that bill.
I was just wondering, is there's not a House version that's gonna be coming over?
No, probably not. But there might be something we could put it into, because the agency, I remember Lindsay was here the other day, very supportive, and the DA was supportive, so. We'll see what we can do. Anything else? We are going to take a break and go off live and come back at 5 minutes